that, and certainly when we come back here on NewsX. But first, let me take you to the Ministry of Information, the Health Ministry. They're addressing press conference. Listen.
To personnel, to policy direction, which intends to improve the quality of service that is delivered by the ministry through Ghana Health Service and other allies. So we are confident that the Honorable Minister will make a presentation that will resonate with all of you and also update you on the wonderful interventions that government is making in healthcare delivery. On that note, I would like to invite the Honorable Minister for Health, Dr. Bernard Okoboy, for his presentation. Then we'll come back to you for the second part, which is the Q&A session. Thank you.
Good morning, friends. Because I do communications as well, I don't know whether I'm allowed to say colleagues from the media. But we are very grateful that you've made the time. Let me also thank my sister, the Honorable Minister, for granting us this opportunity to share with you some of the wonderful things happening at the Ministry of Health, and for that matter, in the Kufuor's government. I'd like to also thank all those who came with me from the Ministry of Health. I see directors from infrastructure, my technical advisor, and I see my policy boss also here. So, as we have on the first slide, I wish we can be showing the slide so that you can follow. I don't know who is handling absolutely. So the mandate of the ministry, I wouldn't like to bore you with a lot of words, but the ministry has the mandate to make sure that all the 31 agencies that come under the ministry work in a synchronized manner to ensure safety, delivery of health, quality health, of course, for the people of this country. We have a vision of a health sector that creates a healthy population for national development. And the mission is to contribute to socio-economic development as well as improving on the quality of life for all Ghanaians. So we have some policies. Today's presentation will focus on some major policies and strategic plans. And then we'll look at financial protection. And respectively, when we talk about financial protection, we are referring to the strength of the National Health Insurance Scheme, how it helps Ghanaians to access health care without the ability to pay being a hindrance. And then finally, we'll talk about access, fiscal access to health care, that's infrastructure. We'll do some presentation on that one as well. So with the major policies, as we speak, the National Health Policy, that's Ghana's roadmap for attaining universal health coverage, and the Health Sector Medium-Term Development Plan provide the broad direction for the health sector. These three policies document Ghana's efforts and interventions and put in place some of the achievements that the health sector is supposed to work on as dictated by the Sustainable Development Goals. We also have objectives for the National Health Policy between this period and 2030, which is to strengthen the healthcare delivery system, to be resilient and to respond, of course, to emerging crises like the pandemic, the mpox, which we have currently, to encourage the adoption of healthy lifestyles. I think as a country, we are sort of used to doing curative medicine, which is to cure diseases instead of looking at how to prevent them. So we have the national policy looks at how to encourage healthy lifestyles. We're also looking at improving the fiscal environment. Largely, your behavior is dictated by the environment, and that is also one of the objectives of the policy. We also want to improve the socio-economic status of the population, of course, through the health delivery system. ensure sustainable health financing. So we also have universal access to better and efficient managed quality health care. We are looking at minimizing avoidable maternal, adolescent and child mortality and disabilities. And we are looking at increasing access to responsive clinical and public health emergencies. Of course, again, like I said, like the Mpox disease. We have the 2022-2025 Health Sector Medium-Term Development Plan with the following objectives: to ensure sustainable, affordable, equitable, easily accessible health care, reduce morbidity and mortality, intensify prevention and control of non-communicable disease. And here, I think the three main ones are hypertension and diabetes, cancers, both adult cancers and childhood cancers, and organ diseases like kidney disease and liver disease. Enhance efficiency in governance and management. So we've also launched a national infection prevention and control strategy, and here we are looking at preventing, to prevent, reduce, and control hospital-acquired infections. In the past, we referred to them as nosocomial infections. I guess the word was big, so now we have a new term, HAIs. And to look at AMR, that's antimicrobial resistance. I think one of the biggest threats now to healthcare is the situation where you give antibiotics and they don't work because they've been abused. It's a big issue, and we have launched this policy to look at how to reduce the frequency of that. We also have launched the health financing strategy, which has the major objective of contributing to achieving improved health outcomes, financial risk protection, consumer responsiveness, and access to quality, essential healthcare and population-based service for all. And here, let me say that Ghana is supposed to transition to fully pay for some of the commodities or drugs that we get with the help of our partners, like HIV medicines, malaria medicines, and others. And to be able to finance these ones over the next few years, by 2032 or so, Ghana is supposed to fully fund these ones. We need to have a financing strategy, otherwise we might have some issues. So we also have the COVID-19 test to treat strategy, and because COVID is no more health emergency, I think it's important to note that this strategy is there to make sure we continue to monitor our borders, to do surveillance, continue to check to see those who are getting COVID, and to see whether we still have it below the threshold that we want it. And so we have that strategy as well. Interestingly, a lot of people don't know that in our public institutions, we have herbal units. And so it's not all herbal medicine or practice that, in quote, is dangerous. We have well-trained herbal practitioners in our hospitals who dispense medicines that have been tested in our labs and are safe for consumption. And so the objective of this medicine list for NHIS coverage is to ensure access to safe and efficacious herbal medicine. As we speak currently, all the medicines that health insurance pays for, they don't include the herbal medicines. And so when I was at NHIS, we worked with the ministry to include at least some major ones on the list. It's going through the process, and very soon government will pay for herbal medicines as well. That is very, very important. So we have some procedures for assessing safety and efficacy of herbal medicines. This is also one of the objectives, to ensure safety and efficacy of the herbal medicines. We'll come to financial protection. So in alignment with the ministry's mandate and policies, we highlight some key financial protection across the National Health Insurance Scheme. I think the National eHealth Project is a Ministry of Health project that has been there since 2017. And ladies and gentlemen, it is good news to say that Ghana has most of its hospitals now connected through an IT system that allows data and history or information of patients to be taken and put on computers and laptops instead of to be written in folders. And we all have had the occasion to be in government hospitals before, prior to the Akufo-Addo administration, where sometimes you have to wait for more hours to access your folder than it takes you to see the doctor. In Korle Bu now, sometimes when we say these things, people assume it's happening in small hospitals. In Korle Bu Teaching Hospital, nobody takes your history with a pen and paper anymore. All your data is on a computer. And by the time you get to the lab man has it on the computer. By the time you get to the theater, your information is on the computer. By the time you get to the ward, the nurse has a tablet that has all your data. And so we have done a significant job to network these hospitals. And if you are transferred from Central Regional Hospital to Korle Bu, teaching hospital, you don't carry a folder. You just have to give your ID number, and the system has all your data. And this has helped a lot to improve access to the doctor and health delivery. So this project has the objectives of optimizing the business process to enhance cost saving, improve systems, and to harmonize them, and to allow hospitals to talk to each other. It's very, very important. So the project scope, each facility is provided with the following infrastructure: networking, there's a local area networking at each facility, and wide area network. Hardware, so we've given to the hospital servers, desktop computers, laptops, and tablets. And the LHIMS refers to the Light Wave Health Information Management System. It is this that we refer to as the e-health project. It comes with training as well. And it is refreshing to know that 99.8% of hospital level facilities are now operational. 451 sites are actively using this system. Over 20.8 million patients have been registered, and 47.8 million patient visits recorded. And this system also allows the hospitals to track their revenues and to avoid some of the revenue losses. So cost savings, the benefits, efficiency gains, availability of real-time data. The good thing is that this system also comes with surveillance. So in Ghana this morning, if across the country, out of let's say 50,000 visits, 40,000 are realized to have had signs and symptoms that look similar and point to a particular disease, immediately it's a red flag. And real time, the Ministry of Health, and for that matter, Ghana Health Service, can immediately tell that something is happening in the country, and we can move to address it promptly. Unlike in the past, where the one sitting at Chebi Government Hospital and the one at Sola District Hospital are not talking to each other. So we can have a serious health threat, and we don't know that something is happening. So these are some of the advantages also with the e-health system. So we also have the National Health Insurance Authority, which most of us are conversant with. And with the National Health Insurance Authority, I only say two things. Before we came into office, and then when I say we, before this administration came, most of the hospitals, as our government hospitals, usually they would do their best to work with health insurance, even if there are challenges or not. But most of the private hospitals would prefer to have an agreement with the most of the private hospitals will prefer to have some agreement with private health insurance and not national health insurance scheme. Because when you take care of people, it will take a year before you get paid under the erstwhile administration. Now, as we speak, most of these private hospitals are comfortable with the national health insurance scheme because we pay promptly. And when I say promptly, within maximum 50 days, they get reimbursed. And the interesting thing is that for the first time in many years, the private health providers, those who run private hospitals, issued a statement and said that life is okay with NHIS. Now they have a problem with the private health insurance providers, the companies, and that they rather were not being as reliable as NHIS. This is not to cast any doubt on our friends or partners who are into private health insurance. I believe it's not all of them who are having challenges. But the point is that there's been significant improvement when it comes to reimbursement. And then the next one, which I want to add, very, very important, is that from President Rawlings' time, since we started the Fourth Republic, till President Kufuor came, any and every Ghanaian who had kidney disease in the past paid for himself or herself until they either passed away and left us, or whilst they are here in this country. Advocacy is good. With the help of the media, civil society, all of us, we've thrown light on the challenge of kidney patients. And I'm happy that this government, typical of its nature as a listening government, as we speak now, all kidney patients in this country who are 18 years or below, 60 years or above, when they go for dialysis, all their dialysis is paid for by this particular government through the National Health Insurance Scheme. And there's another bit which the NHIS has not communicated well. The average kidney patient receives about 4 sessions a month. All these 4 sessions are being paid for by NHIS for those 18 years below and those 60 and above. For those in between, currently, the NHIS is paying for 2 sessions out of the 4 sessions. And so it means that every kidney patient has received either full reimbursement or support or some subsidy from this government. It's the first time since the Fourth Republic that the government has intervened or gotten involved with paying for kidney care in this country. It's the first time. It's not only kidney care. If you have a relative who has sickle cell, you can ask them about hydroxyurea. This is a very important medicine that helps sickle cell patients to live a life which is close to those of us who don't have sickle cell. That medicine helps them to have less crisis events. Crisis means they have severe pain, they can't go to work, sometimes it's hell for them. This medicine, through GOG, government direct engagement with the manufacturer of this drug, settled on an amount that will be paid for. And since the past 5 or 6 years, if my memory serves me right, government has been reimbursing for hydroxyurea. It was not paid for before we came. And as for childhood cancers, I think most of you know what this government has done. Because I was at NHIS, I can also say that for the first time since we entered the Fourth Republic, government has taken steps. Let me take this opportunity to encourage the board of the NHIS to quickly move to make it a reality. Whilst I was at NHIS, our team that looks at benefits and how to codify them, to look at how much we pay for, has codified the 4, I think, most common mental health conditions in Ghana, including bipolar, depression, and I think schizophrenia. So that for the first time, when we visit the hospital with these mental health conditions, the state will pay for these conditions. As we speak now, Ghana, since President Rawlings, and I don't want to start from Nkrumah, I always use the Fourth Republic, has never paid for mental health. We have a vertical program that on paper is supposed to pay for the medicines that mental patients get. But since I started practice in 2009, I have seen mental patients whose medicines they have to go and buy. We have taken steps to codify all these things. And again, my belief is that before the end of this year, the board of the NHIS will quickly look at this package so that we input it in our health packages. And as for my NHIS app, I think that I don't have to belabor the point. Ladies and gentlemen, the technology, the efforts to formalize this country, just like we have elsewhere in other jurisdictions, some people call it developed countries, the efforts has been very tremendous. And so until this government came, you cannot, as a first-timer, get onto the National Health Insurance Scheme. You have to go to a fiscal office, queue, see a manager or a worker before you are put on a scheme. Now, with the help of the Ghana card, if you download my NHIS app, which you can do now on your phone, it gives you the option to input your Ghana card details, pay using Momo, and in the comfort of your room, if you get a message that gives you a digital NHIS card with your Ghana card picture and all your details right on it, you don't need to go to anybody. And if you are 70 and above, instantly you can walk to a hospital and get care without paying 1 Ghana cedis for adults. And so I think we've moved quite far when it comes to access and some of these procedures. I remember somewhere in 2013 when I was at Kibi Government Hospital, sometimes while driving to the hospital or walking to the hospital, you see a very long queue. Women who want to get a card or renew before they come to the hospital. Now with *929#, is that not it? You can quickly check your status and pay on your phone. I've done it for some people in the constituency. Only that when you do it for someone, it is your Momo account that is affected. That's the only challenge. So we have efforts to integrate traditional medicine into our orthodox medicine, and I think I've mentioned that. Human resource for health. I think I wouldn't bother you with the details, but just to say that this government has put in a lot of effort to make sure that we give opportunities to Ghanaian health workers. Recently, we published that we are absorbing over 15,000 health workers, nurses. But my data, which I'll share with you, shows that from 2017 to date, those that we've put on government payroll, we are looking at over 21,000 health workers, from physician assistants to medical doctors to medical herbalists to pharmacists to allied health and all that. There's still room for more opportunities. But the fact remains that averagely every year, this government gives opportunity for the past 7 years to an average of 3,000 plus health workers. And by the way, those that are employed as non-GOG staff, they are not in this data. So when I was board chairman for Kolebu, you have thousands of nurses, thousands of other health workers who are paid for from the revenues of the hospital. That is also employment. It's not only when you are paid from a controller that you are employed. So I think when we add all these numbers, there's opportunity. Today is not mainly Agenda 111. Although Agenda 111 is also health. I know Dr. Nsiansari and his team have done some presentations. But I just want to quickly say that by the time all those facilities become operational, we are looking at an average of 60,000 Ghanaians working in these over 111 health facilities. Remember, it's not only factories that create jobs. People forget. Hospitals create jobs as well. Not only factories. In hospitals, you also create jobs. And so access will be improved, but sustainable jobs would also come along. Migration of health workers. Let me quickly say that anytime you see a Cuban doctor in Ghana, it is the government of Cuba that have sent them here. They have trained enough doctors to keep at home and to give to the rest of the world. At the Ministry of Health, we've done a labor analysis. I'm happy that my director HR is here. The data shows clearly that Ghana is producing more nurses than it requires. We are churning out an average of 55,000 plus nurses annually. Anytime you have more than you need, you have to be innovative and find a way to give opportunities to your nurses. And so at the Ministry of Health, I know some of you are aware that Ghana has nurses in certain countries that have been arranged properly between government of Ghana and the Republic of Barbados. As we speak, by October ending, the third batch of Ghanaians would leave for Barbados. And so it is our prayer that we quickly, under this government, act to make sure that if you are trained in this country, either you are absorbed internally or you are absorbed externally. And Ghanaians have come to the place where we can take on the world. We should not train to take on only the 16 regions in this country. I'm happy to say that the Republic or the island of Seychelles have come to us. We are working on an MOU, They are saying that Ghanaian nurses are doing wonderful in Barbados. And so Jamaica, Seychelles, Germany, UK, all these countries, as we speak, are working with Ghana to make sure that health workers can be properly located in these countries so that as they reimburse remittances to this country, it can also help our economy to move forward. In fact, at the nursing health training institutions, which is the HTI, a unit under the Ministry of Health, we are also working to revise our curriculum. If a nurse is trained in Ghana, they should be able to sit in a plane with the structure of government of Ghana, and the next day when they arrive in UK, they should start working in their hospitals. Currently, what happens is that any nurse or most nurses who find themselves in other countries have to go to school again for some 6 months or 1 year to be able to adjust. We should get to the place where you can move into other jurisdictions. And by the way, it's not only health workers who are being trained to be fit for the world. Teachers in this country now, if you check with education, are now teaching in China, teaching in other countries. We are good at training people to become professionals. We have to move with the speed of the world now. We should look at how to give opportunities globally. But let me end by saying government will continue to work on giving opportunities to our people internally. That is absolutely crucial. So the Food and Drugs Authority, I wouldn't like to worry you too much, but you should know that your beloved Ghana has one of the best regulatory bodies when it comes to the FDA, the regulation of food and medicines. And other countries come here regularly to be trained. I think we are a level 3 facility when it comes to FDA. We are working to become level 4. When you get to level 4, right in your country, you can even give the permission or approval for vaccines to be produced. Currently, even if we want to produce a vaccine here, we must go to the FDA of the US, UK, before we can produce in our own country. We are working on these ones as well. Zipline. And when it comes to supply of logistics using drones, again, this is one of the classical examples where when my man says it is possible, it is really possible. Some few years ago, we were told that it's possible to have medicine you need. I worked in Chebi Hospital, so I like to use Chebi. It's possible to have a medicine you need to give to a pregnant woman who is bleeding, can be dropped in the hospital compound using a drone. A few years ago, some said it's very difficult. In Ghana, I think it's a challenge. But as we speak, it's so sad, let me use it in terms, that for us in Accra, because we have roads and other logistics, they don't drop hospital, drugs at Ridge Hospital. But when you go just outside Accra, most facilities in corners where it takes an hour or two for a vehicle to get to them, when they need medicine, they call the Zipline Logistics Center. I need oxytocin. I want to inject a woman. And within 10-15 minutes, they drop the drug in your compound and the nurse goes to pick it up. In the absence of this Zipline drone technology, either you put the patient in an ambulance from Chebi to go to the Koforidua Hospital, or you put the woman in an ambulance to be driven to Nkoko or Nsawam Government Hospital. Ladies and gentlemen, we are making progress. And I'm happy that in the next few months, we are looking at constructing 2 more delivery centers. And then the map of Ghana, if you draw it on paper, every part of Ghana, when you call, they can drop a drug which you need. And it's not only drugs. Blood products can also be dropped. And when I say blood products, if unfortunately a relative of yours gets an accident somewhere between Tamale and Boga, far away in some corner, and they need drug to be transfused, they can call a Zipline delivery center where you have fridges for blood, some medicines, and they can process and go and drop it near where your relative is. In Ghana, this is happening. And when you say it, I mentioned this in a conference with health workers, and they were looking at each other. For those who practice in Accra and Kumasi, they've not been dropping in the hospital, so they are not aware. Ghana is bigger than these 2 cities. And it is important that we celebrate some of our achievements. Ghana, your own beloved Ghana, went to the US to pick this technology. But as we speak, when I was in Parliament, I was on the health committee. We traveled to Rwanda to learn from how Rwanda was using drones through zipline. But Rwanda had, I think, 2 centers or so. They weren't covering the whole country. Today, we who went to Rwanda to learn, we have the biggest drone delivery system for medicines and blood products in the whole world. Even Rwanda is now behind Ghana, we who went to learn from Ghana. And when Kamala Harris gave a speech and mentioned that, I had health workers who called me and said, is what she's saying, what the US vice was talking about, is it true? Some health workers called me. It only reminds us that we need to talk about our own and we need to visit some of our achievements. And I'll challenge my ministry to do some, outreach for the media. Visit some of these centers. You'll be amazed how a drone will be flown and will get it right and drop a product in a hospital. Technology can get you there quickly. And so that's an example of a drone center. A lot of products have been delivered. I don't want to belabor you with it. So this is the one at Ominako. And by the way, I am excited about these drone centers, not because of even the delivery, but the drone centers act as mini labs and mini blood centers. And it's a good way to make sure that when we are in trouble, we can get help. I'm happy that Dr. Kumabuaji is here. All the viruses in town, if you have questions, he would answer. Ladies and gentlemen, I'm happy that the National Ambulance Service, I'll say, although not perfect, has seen some significant support in this administration. Sometimes it's easy to criticize what you have now and forget where you are coming from. Before, we had close to 307 Mercedes-Benz Sprinter ambulances commissioned at the Independence Square. If you talk to the National Ambulance Service, the ambulances that were on the road from Accra all the way to Burkina border were not up to 60. But we've significantly increased the numbers. And the numbers is not only where we want to end. We are working with the Ministry of Energy to make sure that there is one problem that I knew about Ghana Ambulance Service way back before Akufo-Addo became president, 2013, when I was at Chebi. When you have a pregnant woman who must go for some procedure, if you put her in the ambulance, sometimes the ambulance driver will tell you, doctor, something small for fuel. Over the years, that practice has gone down, but we still get reports of it happening. We are working hard to make sure that in this country, it is possible to have an ambulance service that comes for you without checking who you are even working with. That is what we are working towards. It is possible to get that done. And the Ministry of Health will work with all stakeholders so that we get that done. We have some new ambulances that have also come. I know if I go on and on with ambulances, you ask me more questions on some of the ambulance issues. So let me move on to, yes, and I'm happy that now we are coming to infrastructure. So we have the ambulance training school where we train our emergency physicians and the paramedics. We have some projects going on to give them the necessary infrastructure. Ladies and gentlemen, this is where we'll be presenting the last chapter of today's issues. I think we're going to handle health policies, look at financial assets, which talk about the drone delivery and fiscal assets. Now we are coming to fiscal assets, which is the health infrastructure projects. Because Agenda 111 has had a lot of attention, people assume that beyond Agenda 111, this government has not built any hospital. That is quite sad. There were many who were born before Agenda 111, and some of them would be unveiled or mentioned here. And so NMS Infrastructure is a company that have completed Dodowa and Fomina, Kumewu, Takrady European flats. I know Fomina and Kumewu were started before President Akufo-Addo was sworn into office. But both facilities were not even up to 30% completed. Ladies and gentlemen, when I traveled to Kumewu to commission their hospital, the chief of Kumewu, Omayini, said something very significant. He said, I commend you for not abandoning that which you came to meet. If you are here and anybody creates the impression that this government abandons what it meets, Kumewu is your answer. Not only Kumewu, Fomina as well. Fomina was about 35% complete. The Akufo-Addo government found the resources and energy to make sure that Fomina is completed. If my memory serves me right, I think Dodowa was completed before we came, right? Yes. So this is a company that had all these projects. One was completed. When we came, we have completed the others. And I know that they had it on their books to work on Abetifi and a few others. There were challenges. Even before we came, this contractor had challenges with the government of Ghana. There are letters from my senior then, Honorable Segbefia, pointing out all the issues with the contractor. But we sat down, the Attorney General with the Ministry of Health, and I'm happy that they've completed some of these hospitals. We'll do whatever we can so that others that also have their footprints also get their hospital completed. Ladies and gentlemen, we've also completed 7 district hospitals at various facilities. I've mentioned Kumewu District Hospital. So these are pictures of Kumewu in the Ashanti region. And Fomina, as you can also see, is right on our screens. So we have this contractor, Messrs. Contractor, that worked on these 4 facilities. For those of us who know Tetekwashi, they received some facelift under this government. When you go there, the staff will tell you a lot of things have changed. ATBA as well, Ebri as well, and Kibi or Chebi, as you might put it, at a cost of 40 million euros. For those who say that, where has all the money gone? Just these 4 facilities. This Akufo-Addo Bawumia government has invested 40 million euros. And I'm happy to say that the last time when I visited the Kibi Government Hospital, it's better than what I met somewhere in 2012. So these are some of the pictures that my team managed to get of the refurbishment and some of the inside pictures of the units that had attention. All these slides will be given to you, so sometimes I'll move with speed. So a few weeks ago, I was privileged to be in Bolga to commission the phase 2 of the Bolga Hospital at a cost of $20 million with the help of the Saudi fund. And those who live in Bolga or the Upper East region will tell you what was there some 8 years ago is not what is there today. And when we talk about progress, progress is steady and continuous. And Bolga is also an example of what the Akufo-Addo is doing. And by the way, for the first time, Bolga Hospital has a CT scan that is functional and in operation. Someone will say, but what is the big deal? Before Akufo-Addo came, if you get a severe stroke and the doctor wants to know the kind of stroke, whether it's a bleed or a clot, you need to know which one before you know which medicine to give. They have to put you in an ambulance and drive to Tamale Teaching Hospital to take a picture so that you go back to Bolga for the doctor to know whether to give you medicine that will dissolve a clot or medicine that will stop bleeding. If the doctor, but sometimes, if it's very bad, the doctor must play some, I would not say lotto, but you have to gauge. So most doctors will tell you, if you get a stroke, which is very bad, the patient is unconscious and all that, it's likely to be a bleed. So give something to stop the bleeding. Now, what stops bleeding is supposed to form a clot. If the doctor misses the guess and it's a cloth that you have, you get more clothes. So these are little things that make the whole difference in the world. Bolga has a functioning CT scan under this government. So these are some of the pictures. It also came with staff accommodation, and I believe that we will get there. We will get there as a country. So these are pictures of Bolga. Excellent. So as we speak today, we have a new urology and nephrology center which has been commissioned, which is about to be commissioned by this government. I remember 2020, all the plans were ready. And let me say that as board chairman for the Kolebu Teaching Hospital then, somewhere I think 2018, before we came, under the previous government, there were plans to build a urology center. What does urology do? This urology is the field of medicine that deals with all things that have to do with urinary tract. For men, as men age, sometimes they get prostate issues, and you have to do some procedures for them so that life is okay for them. Children born with abnormalities, they need to do surgery. If it has to do with urination, urology is the answer. Ladies and gentlemen, before the Kufuor government, the plan and arrangement was to build a PPP facility. Government was going to partner a private organization to build in Kolebu a urology center which will operate like a private facility and share revenues with Kolebu. The money was not going to be paid for by GOG. So when I was board chair, the conversation was activated that if you should go by this arrangement, access will be a problem. And so the Kufuor government had the courage to shift it from a PPP arrangement to a fully funded EPC arrangement where you have the procurement, the construction, everything paid for by the government of Ghana through a facility. And I can say proudly that this new center, which we will commission in a few weeks, is the property of the government of Ghana. And when Ghanaians access it, they are going to pay social rates, even if they have to pay something, and not commercial rates. I was also glad that when the facility was tested, this is an ultra-modern hospital. In fact, it's a hospital on its own. Only that, unfortunately for it, it happened to be sited, and my friends in Kolebu should not be worried as unfortunately. I wish this was sited on its own compound, where the men can go for their things in peace. But it's been sited on Kolebu land. So recently when it was tested, an honorable member of parliament in Ghana's parliament now was lucky to be the one to receive the first procedure on his prostate at this facility. And my report shows that everything is fine. His wife is happy, the procedure went well. So this is a urology center. This is an ultra-modern facility. And let me give you a practical reason why these things make a lot of difference in the lives of Ghanaians, ordinary Ghanaians. If you have a prostate problem and they have to operate on you at Kolebu, because you have the theater block having, let's say, 10 theaters, but they are using it to do leg surgery, using it to do abdominal surgery, using it to do other surgeries. Those who work on the prostate can be given, let's say, only 1 day in a week. So they will tell you, oh, this is your prostate. We wish we could do it for you. We are ready. But the theater gives us one space in a week. So we are in September. Please come first week in March. So if you're a man, you have to do with a catheter till March. Now that urology have their own facility and the number of theaters, I hope Ben in Cancer gave me the theater so that I can be prompt. Yes, so the center has a capacity of 101 beds, 70 beds for urology, 51 beds for nephrology. And the nephrology, we mean dialysis. And so hopefully in the next few months, all this noise about dialysis space, we don't have machines, is going to be a thing of the past. We are going to have 51 beds for dialysis, ultramodern sustainable machines. And Ben, all right, so when we went there, 2 theaters. So urology are going to have 2 theaters for themselves. 24 hours, 7 days a week. By the way, the urology department already works 24 hours a day. So this is investment into the life of the ordinary Ghanaian. The old man walking the streets of Tribla in Teshi who has prostate issues. When he walks to Kolebu and now enters a new facility, his prostate is done with. When he walks out, he knows that Ghana is going somewhere. And I'm also happy that this facility was built with teaching and learning in mind. And so this theater, when you are being operated upon, we have a conference room. In fact, not one, there are 2 or 3, like this, where all students and doctors can be watching the procedure live on TV, on the screen, so that you can learn. Some of us, when we went for studies in Kofanoche, even if we are 30, all of us must come into the theater. And if you are not tall, you are in trouble. You can't see what is happening. So these are significant. I see a lot of treatment and holding centers. Some of these treatment centers were built, we built a lot of them when COVID struck or in the process of COVID going away. Most of them are more or less mini hospitals. They have an emergency unit, they have an ICU, and they have a sleep-in, which is a ward. Most of them are average 40, 50 beds. Now what we are doing is that because COVID is not at a level as a public health emergency, most of them are serving as adjunct hospitals, meaning they are providing beds to add on to the hospitals that they are close to. And some of them, not some, all of them have sophisticated equipment more than the big brothers that they are perched, the main hospitals. And it's important to go through. Sewia, so you have a, how do you call it, a treatment center next to the Sewia Hospital. Sewia is in Ashanti. It's a regional hospital. Everything is done. We are working speedily to make sure that it is operationalized next month. And let me thank Dr. Nsiasari. He's been very key in supporting, working with us to get this done. They had some major issues with the transformer that had to be built and all that. Let me also thank the Energy Ministry, Chief Director of the Energy Ministry, Dr. Matthew Poku Prempe, and Herbert Kappa, the new one. We've moved to put in the energy, fix the energy issues. Ladies and gentlemen, we also have treatment centers at Keta. We have Cape Coast. There's a treatment center at the Cape Coast Teaching Hospital. Zebila, you have a treatment center there. You also have, and I know we are on GTV, so those who are watching, greetings to those who are watching across the country. Just pass by the facility that has been captured and let us have feedback. Sewia, 100% completion is not be operationalized because of power issues. We are working speedily to make sure that it is operationalized. This is a 250-bed facility that has been completed by this government. It has all the facilities that you expect. In fact, the Omahini for the town, very active, nearly arrested us for not prompting him before we got into the facility. And apparently, he's worked a lot to make sure that government operationalizes this hospital. So the Ministry of Health has also procured a number of equipments for Koforidua, the regional hospital, Tamale Teaching Hospital, Ho, Cape Coast, and all that. These are ones that later will also give the breakdown so that you can appreciate some of the investments. Cheap compounds. There are numerous cheap compounds, and I know many more communities need cheap compounds. We are going to work to make sure that in this country, you should be able to walk to a health facility. We shouldn't always drive to go to the clinic. It is possible to have that done in this country. We've also had let me move from the cheap compounds to ongoing projects. So, ladies and gentlemen, the Confanoche Teaching Hospital. This is a project that cost 138.5 million euros. For those who have been asking, what have they used the money for? This facility is 60% completed. I visited this facility some few weeks ago. And in fact, we had to do this, meet the press, because of facilities like this. Because I schooled in the Confanoche Teaching Hospital. And I realized that some of my colleagues stay in, even Manchia, don't know that this facility is being built. The worst part is that I met a friend who is at the ONG unit. This is a maternity and child block. It's more or less a hospital on its own. And some of my colleagues in the ONG unit in Confanoche have not gone to see that this is what we are doing for them. And I'm happy to say that this was an old block that I learned was started by General Kutu Achamp. All the other leaders we had did their best, but they couldn't get onto the compound to reactivate the project. Either it looked too big or it appeared impossible. But with this administration, you can see that it is possible. So, ladies and gentlemen, this is a 138 million euro facility. And to give you an idea of the magnitude of this facility, the urology center, which is a huge facility, cost less than 50 million euros. So this project is 3 times that of the urology center in the Ashanti region. For those who say that Ashanti region is so and so and I've done nothing, only in G, like my colleagues will call it, this facility is going on. And I'm happy that we have a very good contractor who is moving with speed to finish it. Because of the debt exchange program, work stopped for some time. But I'm happy to announce that work has started. Yesterday, we had a meeting with a consultant. And by the time this facility is completed, hopefully in the next 24 months or so, it's likely that I'll go back to Confanoche to do some practice whilst mixing it with my appointment in Dr. Baumier's administration. So we also we've had Eastern Regional Hospital in Koforidua. I've been there before. When Dr. Buama was there, I went there. It was one of the finest hospitals. I like the Eastern Regional Hospital because when I went to their labor wards, all the labor wards were air-conditioned. Sometimes we have to point out public facilities that behave like private facilities. So, good morning to all midwives, senior in charges at labor ward at Koforidua. When I saw the awards, I felt like having my partner go to deliver again. Someone would have said that is enough. But this government has had the courage, beyond that facility, to build a new ultramodern Eastern Regional Hospital with state-of-the-art facilities. Most of these facilities you see, like the Koforidua one, they started small. They started as a district hospital. They will add one more block for females to sleep in, one more block, and then we call it a regional hospital. It is not planned from day one to be a regional hospital and to serve the region. So, at the cost of 70 million euros, this government, when you are driving from Koforidua on the way that goes to Suhum, you see a huge block. Unfortunately, the debt exchange worried it. But as I speak, with the support of Honorable Amin, the finance minister, and inspiration from the Kufuor government, work has been reactivated on this project. And good morning to all those in the Eastern region. You are going to have one of the finest ultramodern hospitals in this country. And that also, from my data, has over, I think, 200 beds, 250 beds. It's a very modern hospital. Please, these are not Agenda 111 projects. They were born before Agenda 111 was ever thought of. These are huge investments that we've made in the health sector. And so that is the facility that you have at the Eastern Regional, the site. What's the name of the town where it is? Akwedum, absolutely. I passed by the place, but because I don't enter the town here. So we also have rehabilitation of Efian Kwanta Hospital and construction of a new Western Hospital. And again, this speaks to the courage of this government. I use the word courage. Efian Kwanta on paper is a regional hospital for Western region. I say on paper. Because if you go there, some district hospitals have big muscles than Efian Kwanta. But for the first time, we had an administration that has been bold to say that we would redo this hospital, more or less. So at a cost of about 90 million euros, I'm splitting into the new one and the old one. So the 190, you are talking about 90 million euros to build a new hospital within the current premises, Efian Kwanta. And I visited that some few weeks ago. And these are some of the pictures. This hospital has everything you can ask for, about 250 beds. It has theaters for obstetrics. It has a whole floor for theaters for surgery. It has everything in a modern hospital. But I talk about courage because the Kufuor government didn't only dare to build a new one. They said, let's have another one at Apimenim within the Western region, so that there can be sufficiency and there can be real access when it comes to accessing hospitals. That one is also at an average cost of 90 million euros. So this is the courage I'm speaking to. When others have tried to manage with one which is a cake, an administration comes and says that we are doing two at the same time. And I'm happy that although the debt exchange program, because of the facility we were using, sort of impacted on the work speed, the one at Efian Kwanta proper has moved as expected. It is the Apimenim one which has had significant disruptions, and will continue to work hard. Every challenge you see that you encounter, it is possible to deal with it. Governments are not elected to avoid challenges or not to experience challenges. It's the capacity to deal with them that we are interested in. And let me thank Honorable Mesa, Madam Ivamens, all the people in the Western region, the medical soup. There are people who have moved to make noise, to fight, to ensure that Western region gets what they deserve. Honorable Kobe, and I'm happy that they have fought a good fight. And today, they are part of these legacy projects. It is possible to also complete them beyond 2024. So rehabilitation of Efian Kwanta is going on. These are all those watching from Tadi. So you can see this. I joined the workers to do some action. So you can see the pictures on the screen. I was very excited when I went there. So as a Winsu Treatment Center, we also have that. This section, I want to, as for the treatment centers, we've done so many. We'll give you the details. I want to focus on the big ones like the Eastern Regional Hospital, the Efian Kwanta, and then Kolebu. What do you have? Treatment centers. Well, I visited Kolebu. Those watching from Kolegono, a lot of things. So let's come to, because I met some guys in that area, and they spoke in Ghana. Doctor, one akonoko means they've not seen anything. Apparently, they've not entered the hospital environment. La General Hospital. Ladies and gentlemen, the last hospital I worked in before going to Parliament was La General Hospital. When I was in La General Hospital, early 2016, whilst working on the ward, concrete slab will fall, hit the ground whilst you're on ward rounds. When I entered Parliament, any organization that I had a relationship with, when I went to Parliament, I didn't leave them. Anyone who's been part of my life from JSS, in fact from KG to where I am now, I always get close to see how I can use my offices and influence to support. So I visited management of La General, and they told me, Doc, the concrete slabs are still falling. One day you hear on the news that we are all gone. And so whilst I was MP, 2017, I engineered a visit to La General Hospital with Mrs. Baumia, Samira. So I have all kinds of tricks I use to get work done. Then we went to give things to pregnant women, and as part of the visit, we went to meet management. Samira Humanitarian and Empowerment Projects. The second lady has this civil society NGO that uses to bless women and children. So I told her, Madam, let's go to La General. I knew why we were going there. She didn't know. So when we got there, management said their number one problem is that La General was a death trap. Doctors and nurses in La General. And so I was the servant who takes feedback from our visits with Mrs. Baumia. So I took it to Honorable Ajimamenu, my former boss and predecessor. And Ajimamenu said, okay, Oko, me, I don't live in I'm not a Accra boy. So get some of your people. So I got Honorable Henry Quote and others. And then through our lobbying, they got a company to come and do structural audit of La General Hospital. The audit report showed that that hospital should have gone down years ago. It's a death trap. And again here, let me say that before I became minister, I had been fighting the infrastructure people. I asked them, what are you doing with the audit report? Share with the public. And I guess because either it's bureaucracy or civil service, the report didn't come. So some said Akufo-Addo didn't like guns so much that he went to break down the hospital when he had no plan to build one for them. Ladies and gentlemen, I am lucky, or let me say I thank God that I was part of the 7th Parliament, and we approved a loan that was to pay for the construction of the La General Hospital. But because of the debt exchange program, many finance houses, when we got into the global financial crisis, they pulled away from arrangements. And that's why La General stalled. President Akufo-Addo called Ministry of Health, Finance, and said, if that exchange will slow it, we have to find money and pay from GOG. And I'm happy to announce that La General now is being built from coffers of government of Ghana with our taxpayers' money at a cost of 50 million euros. When I visited the Lao Traditional Council and told them, I'm going to chase this Chinese contractor to make sure that he builds, they said, oh, doctor, you are coming after 7.5 years. We have been with your predecessor. But I thank God that Finance Minister, Honorable Amin, with support from Cabinet and President Akufo-Addo, got money released to the contractor. And when you drive by La General today, you will get to know that when the Akufo-Addo tells you, I'm going to work on a project, he means it. It's not a story. And recently, the La chiefs, the La traditional authorities, one of them called me. We went there a few days ago with Dr. Baumia. I said, Dr. Kam, in Ghana, you came here to tell us it was not a fluke. We can see. When are you coming back so that you get some applause? I don't want to rush and go. The building is going to the sky, so give us some few weeks. We'll be coming. La General, it is possible. Ladies and gentlemen, so La General is going up with speed. It's going to have one of the finest hospitals in Accra. One of the finest hospitals. And this is the building. This one is actually the accommodation block. So La General is not only a hospital, it's also going to have accommodation. When we were there, everybody for himself. Nobody sleeps in that hospital. Of course, we had a mortuary there, so maybe it's for the dead. So let me go to, I think there's one more, and then maybe we can go to the Q&A session. We had Tema General also on our screens, so you can see construction of Tema General, Central Medical Stores in Kraza and Doma. This package had challenges because of the debt exchange. And so when you go to Tema General, you see some of the pillars, but the work has stalled. Ladies and gentlemen, like President Akufo-Addo said, for those who die, we can't go back and bring them up. But for projects that stall, we can work our way out and reactivate them. And that's what it meant by we know how to bring back the economy. As we work on this economy to go full speed, just as La General has been reactivated, Eastern Regional Hospital has been reactivated. Our friends at Tema General, should pray for us. That one also will be reactivated at the right time. I now want to go to these are 12 hospitals. Ladies and gentlemen, these are 12 hospitals that were started in 2021. And I don't want to repeat who was handling government or in charge of this country in 2021. For those who say not even one hospital has been built by Kufuor, we have these 12 hospitals spread across various parts of this country. And I'm happy that at least I went to Suame to see Suame's hospital. Anything you get in a hospital in Berlin, Hamburg, Madrid is at Suame. About 45-bed facility. Jumapo, Kwabin, Drobonso, Masun Kwata, Sabronum, Mim, Bon Katamansu, Chudie, Achasi, Suame, Nkwetia, Edukrom, all at a cost of 71 million euros by a very good contractor, Vamed. I call them good because my experience with them, they deliver on schedule. So these are the facilities. And although you see 95, 94, they actually completed. They are referring to accessory facilities. Sometimes a road dam must be graded and all that. And I'm happy to say that all these facilities, Ghanaians must enter them before the end of this year. So that's the Edukrom facility in the eastern region. Pon Katamanso. As for Pon Katamanso, greetings. When we went there in 2020 to cut out, someone told us that anyone we've seen this for years. They thought it was impossible. And then now every morning they go and check how the place is doing. I'll be coming there myself to check it out. Bon Katamansu in Greater Accra, it's done. So these are some of them. And although you see them, they look like medium-sized hospitals. They have all the things you need in a basic hospital. All the things you need for a doctor to be able to save a life. From cesarean sections to hernia operations to dealing with heart, all the things that you need. So you have Achiasi, you have Sabronum. These are some of the pictures. And for those who are watching, MIM. If you hear MIM, you think of timber. But now you have to think health as well. Suame, I was in Suame. Drobonso, Masun Kwanta, all these hospitals, Chudie, across Ghana, all these are outside Agenda 101. Agenda 101 was born recently. And we also have this project, trauma hospital being built in Obuasi, Enyinem, and maternity blocks in University Hospital and rehabilitation at Obuasi Health. So, good morning to our friends in Obuasi and Enyinem. They will speak to these facilities that the Kufuor Bamia government has invested in. So this is Obuasi trauma, about 55%. We'll move to complete that one as well. And Obuasi Health Center. So this NJC government hospital, 92%. When you see 90 plus, it tells you that we are doing finishing touches. And that it has become, the last time I visited a church in my constituency, I told one man, it is possible. He said, Doc, you have to shift from it is possible to it is done. When you see 92% plus, it is actually done. So we also have some primary health facilities. And this one is very interesting. Since the Fourth Republic, in the whole of Accra, population of 6 million, largely we have only one children's hospital, Princess Marie Louis. They recently wrote to me, DG, the health minister, that they were going to go on strike. They will wear red band because the hospital, this good morning to them. After DG intervened for me, they have calmed down. That Princess Marie Louis, it was built, I'm sure, before Ghana became independent in 57. That has been our only children's hospital in the whole of the Greater Accra region. The only president who had the courage to build a new one is Nana Addo Dankwa Akufo-Addo. So when you go to Weja, Bawe, municipal, what they refer to as Akawe, is that not it? You see a huge building next to it, and I think the pictures are on the screen. This is an ultra-modern 120-bed children's hospital that is being built, and we are working with speed to make sure that before the end of this year, those in Princess Marie Louise relocate to the new Wager Municipal Children's Hospital before the end of this year. And I went there. The facility is so amazing that I picked intelligence that some of the health workers in Greater Accra wanted it to be a hospital for everybody, 18 years and above or below. We are not going to agree. It's for children. It's going to remain for children, and it will be protected for children. DG, for your information. All lobbying behind should stop. It's for children. So we also have some infectious disease, a training center for infectious disease at Pantan. I've seen these structures. I wouldn't like to bore you. So I see my big sister, the minister, information minister, moving in his chair, indirectly telling me that we have to move to the next session. So ladies and gentlemen, I thank you very much for your attention, and we'll move to the Q&A. Thank you very much. I see that.
Thank you so much, Honorable Minister. But I believe before the Q&A, I'm informed there is a very short video that the crew would like to show, if it is ready. If not, we'll move to the Q&A session. Please, if you are ready, let me know. The sound is off.
Are you gonna help me save life, bro?
I must say that we do not own the copyright to this video, but it's being used for demonstration purposes, just for people to know what is happening at the zip line.
What do I do?
So we've already loaded the package inside the zip.
Okay.
So you just take it like this, then so come this direction. Then there's a handle here.
This is the first time I'm applying my engineering career. Okay.
Yeah.
This side, right?
Got it. Yes. So just set it.
Aviation engineer. The clip.
So you have something we call the walk-around checks.
The walk-around checks,
Yeah,
huh?
you start checking by looking at the voltage when it's not falling to the low voltage that we don't expect. Yeah, exactly. Then we check the launch rates, whether they are seated, the nose cone is flashing and secure.
Okay.
I'm going to let you launch the drone, so I'm going to ask for clearance. Are you ready?
I'm ready, more than ready.
Zipline 639, request for launch. Space is clear, launch is clear, no wind.
Delivering in 5 minutes at Kwana Arco HC.
No wind, clear to launch after exceptions closed.
Clear to launch. So are you ready to see the light?
Of course, more than ready. Huh?
So come to this side for me.
Okay.
I'm going to release this button. I'll press this. This will turn green, and you just press this button.
Okay.
Right. Spinning motors. Launching 639 now in 3, 2, 1.
702.
See, this is medical logistics made easy with just a click. My goodness.
Thank you so much. You have one more. Please go ahead.
Sometimes you go to the records room to get your folder. It can't be located anywhere.
First, when clients comes, they have to wait for a long time at the OPD. But now with the e-health system, when they come, because the information starts from the OPD. Before they reach the ward, the information is already on the machine.
At first, when you come, what happened was that you come, even if you come early, you waste your time. You won't go. Sometimes you come around 6 o'clock and you be going to the house around 3 o'clock, which was very bad.
the folders are misplaced, and then we don't have a big place to keep some of the folders. So we don't get some of the folders. We have to issue new folders for those who are already having the folders.
Health is continuity of care. At times you want to review whatever the patient brought in. So the e-health is helping us in that way. Not repeating, they can't find my folder and they will issue a new folder. No. We always have to be going on them. You want the new old folder, but if they don't get it for you, what do you do? Yeah, you have to restart.
It was not helping us at all. But now with the LEMS, we are going on folderless. You just come, I just add you to the system, then you are off of this place. Not going for searching any folder, retrieving any folder, just a one-on-one communication, then you are off from me.
And God willing, inshallah, in the next chapter of this government, complete this project, operationalize this project so that it will go to impact health service delivery in the whole of the Western region. I would like, Honorable Minister, let me say that it's a 2-day working visit for me, the Ministry of Health. Yesterday, we visited the Lubo Polyclinic, which is a 40-bed facility, together with a 20-bed treatment holding center facility. So in all, you have a 60-bed facility that was started in 2019 by the Akufo-Addo government and has been completed by this Akufo-Addo government in our tenure. We also visited Takwa in Swahim, where we had another 40-bed facility started and completed by this government. So within the Western region, there is evidence of this government when it comes to investments, it comes to commitment to health infrastructure.
Okay, thank you so much, Honorable Minister, ladies and gentlemen. I am so impressed, Honorable Minister, when you spoke about the quality of health delivery in rural Ghana, especially in the Upper East region, and you mentioned the Bogatanga Regional Hospital. It resonated with me very well because I am from that region. And the impact that this government has made in the last 8 years has been so impressive that I feel really fulfilled that I advocated for this administration, and this is where we are. If you go to places like Garu, Tempani, Binduri, Kusiga, the largest investment in healthcare delivery is done by this government. And I have seen it because I went there recently and they were preparing to commission the Garu District Hospital Agenda 111. And I am so shocked that if anyone who asks you where the money went or where did the money go, because the money has gone into saving lives. And clearly today you have demonstrated the huge investments we've made at every corner, any part of the country when it comes to healthcare delivery. So thank you so much to you and your technical teams at the ministry. On that note, ladies and gentlemen, if you have any question, this is the best time to ask. If we see your hand, okay, ladies first. I'm biased. Right. Okay. So we can take the first 5 questions. David will bring the microphone to you, and then we invite Honorable Minister for his responses. But permit me to acknowledge our media partners who are picking the feed live. We are on GTV, Joy News, Oman FM, Netu TV, Movement TV, and streaming on Facebook at Ministry of Information, Ministry of Health, Think News Online, and Kofigo TV. Thank you.
Good morning. My name is Judith Brown. I work with TV3. I have 2 questions actually. And the first one is directed to the Minister of Health. I want to ask, when would the Agenda 111 hospitals be commissioned? And also, what are their various stages of completion as of now? And my second question will be directed to the DJ of the Ghana Health Service, and that's on the outbreak of polio in the eastern region. What has been done to, contain the spread in the country? Thanks.
My name is Ebenezer Kofi Amponsa with the Daily Guide. Want to find out from the Honorable Minister of Health, Honorable Kuboy. I'm interested in Light General Hospital. I think you didn't share with us any timelines. In June, when you paid a working visit there, you said we should expect it to be within 28 months. Assuming NPP does not, the possibility that you talk about doesn't become possible in 2025. What are the plans to ensure that the Lagino Hospital is completed? Thank you.